Recovering from surgery and nutritional needs. No matter what kind of surgery you are having, you will need to make sure that you're doing everything that you can to make your recovery period as easy and comfortable as possible. It is important that you get enough rest, take your medications as directed, and eat a diet high in nutrition that can help you get your body back to its optimal health level. Except in the cases of some kidney diseases or liver damage, most people who are recovering from surgery of any kind will be told to increase their intake of protein, especially low-fat dairy products and plant-based proteins, because of the vital role that protein plays in restoring the body. When you come home from the hospital, you will be given doctor's orders that will cover all of the do's and don'ts that you should keep in mind as you recover. It will list off what you can lift, whether or not you can bend over, drive, and other things that will either speed or hinder your healing process. If you have any questions, ask before you leave the hospital or call the doctor immediately. There are several areas of life that will be addressed. These are the most important: nutrition, resting and pain control, medications, activity level, cleanliness and wound care. Nutrition. The surgeon will give you guidelines for when you can start eating normal foods or even solid foods. If you were given general anesthesia during your surgery, it is likely that you will have a sore throat from a tube they place down your throat and you may not feel up to eating. Many people are nauseous or feel bloated after surgery as they work to rid themselves of the extra gas in their stomachs. This is all perfectly normal. You might be better off starting with lighter, mostly liquid meals the first few days, but should make sure that you are getting nutrition frequently so that you do not get weaker than you already are. Making sure that you are getting the right amount of protein at this time is important because it can help you get your strength back faster, in addition to the other functions played by protein in the body. Protein supplements are a great way to make sure that you are getting enough protein without having to try to eat a large meal to get it. There are a number of ways to get the protein that you need, including protein shakes, protein powders, protein bars and liquid protein supplement shots. Finding the right kind of supplement for you is important, but make sure that you discuss this with your doctor so that you are not getting too much protein for your condition. Protein shakes are easy and convenient and can help to make sure that you are getting enough calories each day as well as the right amount of nutrients. Because they are already mixed and ready to drink, these protein shakes can be great, especially for the first few days of recovery when you don't feel like moving more than necessary. Protein powders come in 4 types: soy, whey, egg and rice, and can be either created from a single protein or a combination of more than one. These protein powders are beneficial for a number of reasons, including boosting immunity and providing the amino acids that are necessary for normal body function. Whey protein also contains a protective and antimicrobial property called lactoferrin which can help promote wound healing. Anyone with a food allergy of any kind should stick to the single protein powders and should consider rice protein, which is hypoallergenic. Protein bars can be added when you are ready to start eating solid foods but should not take the place of full meals. They can be used between meals as a snack to give extra protein, however they should be low in added sugars which can deplete the immune system. Protein supplement shots like ProfectR can be used either with meals or as small, between-meal snacks. ProfectR is only 100 calories and less than 3 fluid ounces but has 25 grams of protein per serving. It is available in a number of flavors including blue raspberry, fresh citrus berry, grapefruit mango, cool melon splash. Again, make sure that the doctor approves of protein supplements before you start using them, and keep in mind that while you do need protein, you need the right amount of it as well as the right amount of other nutrients. For those who have diabetes or kidney disease, protein amounts will be lower than for other people. In addition, the American Heart Association recommends that the diet should not have more than 35% of its daily calories from protein sources. Resting and pain control. In addition to making sure that you're getting enough of the proper nutrition, your recovery will depend on making sure that you are resting enough during the day and getting adequate sleep throughout the night. The body does much of its healing and restorative work while you are sleeping, so rest is very important. Make sure that you are not allowing yourself to get too tired throughout the day and never push yourself past your limit while you are recovering from surgery. Pain control is important as well. Make sure that you are not letting the pain become too intense and take your pain medications as directed. If you allow the pain to increase, the medications will not be as effective. Medications. Some medications should be taken on an empty stomach and some work better with a modest meal. Some will cause stomach upset if you take them before you eat. Make sure that you understand how and when to take your medications, including whether or not you should eat when you take them. For those meals that say you should take with a small meal or snack, ProfectR or a glass of low-fat milk are perfect options to consider. Activity level. Make sure that you are up and about as directed by the doctor. It prevents blood clots in the legs as well as other problems, but that you are not overdoing it or trying to do more than you are allowed to do. Never lift if you are given a weight restriction because you can cause damage to your incision and set your recovery back in the process. Cleanliness and wound care. Follow the directions for wound care, especially in regards to washing your hands before changing dressings or doing anything else with your wounds. Making sure that you are getting the right nutrition will also help with wound care and speedy healing. Lactoferrin, a microbial property in whey protein powder, is beneficial for wound care and can help with faster healing and better scar appearance. Your recovery depends on a number of factors, each working together to make sure that you are healthy and strong. Proper nutrition gives your body the nutrients and building blocks to restore itself, while getting enough rest allows your body to recharge and refresh. Your body needs all of its strength to make sure that the immune system is as strong as possible so that it can continue to fight infection and heal the wound that the surgery left behind.